Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Dr. Meghna Dassani speaking on pediatric sleep apnea. Meghna Dassani DMD is passionate about helping patients with sleep-disordered breathing get the treatment they need to live healthier, happier lives. Throughout Dr. Dassani's career, she has gained invaluable insight into what it takes to implement those services into the practice and currently shares her knowledge and experience in her role as a speaker. She is an international speaker that strives to leave audiences with the knowledge and skills necessary to deliver sleep apnea treatments. And her new book, Airway is Life, is coming out on February 16th. For more information, check out her website at meghnaDassani.com. Hi, Dr. Dassani. Welcome to the show. I'm so excited to have you on today.
Thank you, Dr. Brayton. I am super stoked. It's such a pleasure to be speaking with you. Finally.
This is going to be such a great episode because we're talking about a subject that is quite near and dear to my heart as a practitioner who works with a lot of infants with tongue and lip tie, and and seeing the progression of when these ties aren't revised, how it can create so many health issues, including sleep apnea for the child as they develop into an older child and beyond. So, and that's one, I'm sure, of many causes for sleep apnea, right? You're going to educate all of us about what sleep apnea is, especially in the pediatric population, and what parents need to know about this so that they can be proactive and make changes.
Yes, absolutely. So we'll start at the very beginning. You and I know this, we deal with this every single day, but just for the listeners, kind of a little refresher. Sleep apnea is when a person stops breathing for 10 seconds or more, multiple times throughout the night. Now, when we say multiple, that applies to adults typically. In children, just the one time an hour stopping breathing is considered positive for sleep apnea. And even for adults, I tell my patients this, and I know we were talking about it earlier, is sometimes just the one time is enough. I mean, the damage that the lack of oxygen does to our brains, to our bodies, the healing, the repair, the rejuvenation, nothing happens the way our bodies need it to. Those neurotransmitters aren't being replenished, being topped off. I mean, we could go on and on and on into that. But bottom line is we need to sleep. We need healthy sleep. And our bodies, our brains need the oxygen. And, when we say that person is stopping, child, adult is stopping breathing for at least 10 seconds, and you've seen this, the 10 seconds is the minimum for it to be classified as an apnea. We've seen folks that stop breathing much longer. And that is the scary part when we stop breathing. Anybody that's noticed it, it's not a fun thing to observe, and it is extremely alarming. So I'm glad you are raising awareness. We're talking about this, and hopefully we'll be able to give families, moms, dads, parents, means to connect the dots for the wellness, for the health of their families. As for children, I know we kind of mentioned that earlier. Well, for anybody, we want to catch them as early as we possibly can, because once the damage is done, it's irreversible. We want to make sure we are able to especially in kids, we're able to get them the oxygen their bodies need to be able to grow. And in adults, typically our adults will present with the classic symptoms, right? They'll present with snoring, they're choking and gasping in their sleep, they're trying to catch their breath, they're tired during the day. With kids, though, it is all across the board. We could have 5 kids that are positive for sleep disordered breathing, and they will have 7 different symptoms, and they're just presenting differently. In babies especially, right? When we see a child, and how frequently do we see a child that sleeps with that arched back, and the neck is in a weird position, and it's it looks uncomfortable. I'm going, this baby's trying to open up their airway. They're trying to breathe. Reflux, babies that present with reflux. Is there a stopping of breathing that's happening that is causing that tremendous suction that happens? It's pulling that acid up. Is that a cause? Possibly. We need to make sure that is being evaluated. Tongue ties and lip ties. We always associate those with difficulty in nursing, right? And breastfeeding. I'm a huge proponent of breastfeeding. When it is difficult for both mom and baby, yes, tongue ties, lip ties do play a role. If that is something that that is mom's preference, preventing the baby from latching correctly. What is that doing? Everybody's tired. Everybody's frustrated. It's painful, right? For mom, baby is frustrated because they're not getting the amount of feed that they need.
And they're actually starving.
Exactly. And they're not able to latch on. And how much air are they taking in? Is that contributing to the gassiness, the dribbling of the milk? Just one thing leads into another. Those are rabbit holes we could go down, but that baby isn't thriving because they're not getting the nutrition that they need. And when we see a child, or even an adult for that matter, that has a tie, basically having a tongue tie, be it anterior, be it posterior, is when that tongue, the frenum that attaches the tongue to the floor of the mouth, is super tight, short, and that tongue is resting in the floor of the mouth. That's not where the tongue needs to rest. The tongue should be resting passively in the roof of the mouth. And the tongue is acting as a passive expander. It's acting as a passive retainer among the strongest muscles in our body, right? That is what is causing the jaws to develop. The roof of the mouth is also the floor of the nose, which is the beginning of our airway, right? The upper airway begins right there. And when that development doesn't happen, because now we have a child that is tongue-tied, lip-tied, maybe has a buccal tie, forces that they're applying to be able to get that nutrition, be it tongue, be it breastfeeding, be it bottle feeding, pacifier, whatever it is that sucking their thumb, fist, whatever it is that is going on, those forces are now actively changing the shape of that upper jaw. Instead of the tongue sitting where it needs to and allowing for that growth to have that nice wide U that we want, well, now everything's just scrunched up. So now we're setting this child up for a narrow upper airway. Well, one thing leads into another. As this child grows up, this child is struggling to breathe adequately. This is a child that is possibly we see is constantly getting sick, ear infections, because of the resting posture, oral posture for this child. They are probably now developing mouth breathing. And if they're unable to breathe through their nose, forget how to breathe through their nose, mouth breathing is so much easier. Guess who has to do the work to purify, humidify, warm that air, which the nose is supposed to be doing? Well, now it's the tonsils that take up that job. And then we see the tonsils, it's not their job, right? And
so then we see tonsillitis and tonsillectomy. That was me at 5 years old.
Yes. So these are kids that have huge tonsils touching in the midline. They're constantly sick. They're getting all these infections. And when we have these tonsils that are enlarged, what I call kissing tonsils, they're so close to each other. Well, that's an obstruction. That is a physical obstruction that, again, is going to contribute to, are we is this playing a role in obstructive sleep apnea for this child, in sleep disordered breathing? Because now there is a physical obstruction. That tongue that needs to rest in the roof of the mouth is now falling, has nowhere to go except falling back when that child is asleep on their back. It's one thing plays into another. So when we can make sure that the screening happens, the awareness happens for parents, for healthcare providers to be able to guide parents into, maybe this is where you need to go. Maybe this is what needs to happen. Maybe this is what is going on. The more answers we can help moms get, the healthier babies, the more healthier lifestyles, leading into healthier adults, right?
Right. So if a parent is suspecting their baby or child has sleep apnea, what do you recommend?
It all depends on the age of the child. So I tell parents this, we typically, as dentists, we see patients when their first tooth comes in. Average is about 6 to 7 months of age. Younger than that, it's usually the lactation consultant or whoever their pediatrician that tends to catch it. For example, we had
Catch what? The tongue and lip tie?
Yes, if the mom's having trouble nursing, or if the pediatrician is one that is screening for this, then that sets off that chain. More commonly, I'm seeing my ENTs are getting involved.
Not in my area. In my area, it's the lactation consultants. In my practice,
That's
our
amazing.
pediatricians aren't checking, so it's unfortunate. It's not something that I guess is part of their training.
Yeah. And I tell moms this, I said, there's so much for us to learn that
Yeah,
I completely understand, which is why working as a team is so amazing, because we
yeah,
all have one common goal, is the health of your child. So starting with, if it is a tongue tie or a lip tie that needs to be released, like you said, it's the lactation consultant that probably picks it up first. Or if it is a mom that has not experienced this, then they kind of start to look further and deeper into it. Getting it released, ENT, the dentist, we use lasers now. Super
yeah,
easy, quick, get it
yeah,
out, get it
yeah.
addressed, and immediate result for baby. They're just able to latch on so much easily. Everybody's so much happier. We had, I was talking to you about my ENT, and I'm working with my ENT currently on a 2.5-month-old that has big issues going on. Everything has been released, and you just have to work as a team to get that child what he needs.
Mm-hmm. Yeah. In our office, the body work with chiropractic and physical therapy are a big part of that too. And I always tell parents when you do the revision, that child also needs some sort of hands-on work, a craniosacral therapist, pediatric chiropractor, pediatric PT, because the revision alone isn't enough to address the underlying fascial issues and dural tension.
I cannot agree more. That is
Yeah.
absolutely right. I tell moms this. It's like, you got to see them before, you got to see them right after you see us, because
Yes.
it helps. But all of those tensions that are built in, that needs to be realigned. You have to work with, like you said, either your chiropractor, or body worker, whoever it is, the osteopath, making sure that they are getting the help that they need. Older kids and even adults, myofunctional therapy is huge, especially when we're releasing this. Because with babies, they haven't had a chance for the tongue to get that muscle memory built in. We give them all of the support around the tie being released. But for older kids, adults, retraining that tongue where it needs to sit.
What age does that start?
With myofunctional therapy,
Yeah.
you can start it with the younger kids too, because basically we're teaching the tongue where to sit. What I find is that we have the best compliance with kids that are about 4 and up, just because they then have the attention span to sit and listen, follow directions, because it's not just, oh, you go to the myofunctional therapist and you do your exercises. Well, mom needs to follow up at home too. And the last thing we want is it turning into a punishment, right, for the kids as well as the
Right.
parents. So again, I tell parents this, and this, it is not a cookie cutter, one size fits all protocol for the children that we're seeing. We got to figure out who needs what at what stage, and kind of lead into that for those kids, just guiding them. It's like, how can we help you feel better? How can we help you get to the best health?
Dr. Dassani, the myofunctional therapy, that's essentially learning to put the tongue to the roof of the mouth. Is that the exercise?
Correct. So there is different exercises that will target the different muscle fibers in the tongue. And basically what we want to do is train the tongue to sit passively in the roof of the mouth, and not just the anterior, not just the tip of the tongue, but even the posterior tongue. So I tell parents this: we want to imagine that your tongue is a heavy blanket that is just flopped onto a, couch. Only thing is, now the couch is the roof of your mouth. So most people, even if you think about it right now, like, yeah, my tongue's touching that little bridge behind our 2 front teeth on the top. What about the back of the tongue? Is that also resting in the palate? And sometimes it has to be something that we train the child, the patient, to do. And there's more and more research that we're seeing that shows that myofunctional therapy does play a big role in helping with the sleep disordered breathing and even sleep apnea for kids, adults. So it's a great tool to incorporate into everything that we're doing. Now, when we have kids that, say, have a 7, 8, 10-year-old, well, even 5-year-olds, that have that tie, or just genetics, how their bodies developed, just have narrow jaws. They have micrognathia. Their jaws are set back. That's when, as dentists, we come in. We have to make sure we're expanding, we're making the room, because just releasing the tongue at this age is not going to set everything in motion. That's what you need to direct growth. So be it expanders, be it appliances, be it a combination of everything, because we're using growth spurts. We're able to use their active growth that is going on to kind of direct where are they deficient, and do we need anterior? Do we need it to go transverse? What do we need to get that child the best airway possible? Because when they are kids and we are addressing this issue, then we are able to grow their airway. And I will take fixing something over putting a Band-Aid on it, if that makes sense.
Oh, of course. And I also find with those older kids with palate expanders, getting that hands-on body work with craniopathy is
Absolutely.
so powerful in combination. I have a question for you. So I have a patient, an adult patient with a severely narrow palate, and she's been on this quest for years of how to heal herself. And I'm doing hands-on work with her, but she's quite severe. And we got her in front of a dentist who specializes in this type of work. And he's going to be fitting her for an appliance to help expand her palate, even though she's in her 40s. And he mentioned that she had severe environmental allergies as a child, so that a lot of nasal allergy issues can also create these airway challenges. Like, she always thought it was the tongue tie that was never released. And so is there a combination of both, or does the tongue tie create the nasal allergy symptoms?
I find it's usually a combination. Yes, the tongue tie probably played a role in the growth and development, right? Narrow, of course, I haven't looked at anything, but just a thought process here. Narrower upper airway, nasal breathing may or may not have been the best. And then throw in environmental allergies. I wonder if there are any dietary allergies as well.
Mm-hmm. Yeah.
Getting food allergy testing done. I find dairy can be a big culprit because it tends to produce mucus within our body. It can impact the mucous membranes. If there is swelling, even though, and I don't mean swelling, but any kind of inflammation, subclinical, that again tends to decrease the size of those airways. So figuring out what is going on, patients like this, I usually tell them, it's like, hey, would you mind just discontinuing dairy for a bit? Or I work with their MDs and say, or nutritionists and say, let's see if we can cut this out and see if it makes them feel better. 2 to 3 weeks. We'll know.
That's a no-brainer.
Yeah.
Like you said, food sensitivity testing is an easy way to look to see what foods are creating inflammation in your body. Mm-hmm. And, that can be presenting as environmental allergy symptoms. And even in a child, right? This is the same thing. It's not just relevant to adults. So that's fascinating.
Definitely. Yes, most definitely. I find dairy and gluten are the big ones lately.
Yes.
Those are the first two that I always talk to patients, be it parents or even adults. It's like, let's humor me. Let's see if we can get you feeling better. And when they actually do feel better, it's just like, whoa, what happened here? So that's right. It always helps.
Very cool. So when you were talking about children having sleep apnea symptoms that could present differently than an adult, can you kind of go over what some of those symptoms are?
Absolutely. The big one for adults or kids, and I know we're talking mainly kids, is snoring. Snoring is never something that we should be okay noticing. And that is a big one. I always tell parents, if you notice your child is snoring, record a video. We're always taking pictures of our kids. Go and record that video. This enables your doctors to see what you're seeing. We have a different take or perspective on it. Let your doctors see what you're seeing. So snoring is always a big one. Mouth breathing. A lot of kids present with mouth breathing, even when we are in the practice or walking out and about. It is not uncommon nowadays to watch kids either have their phones or tablets or whatever in their hand or playing their games, and they're sitting there with their mouth open. That the slack jaw posture, we have to look further deeper into that. So mouth breathing is another one.
That's interesting. I only thought about mouth breathing while they were asleep, but they can also be mouth breathing while they're awake.
Yes.
And neither one are normal. They should have their mouths closed, breathing through their nose.
Correct. Because what happens is when it's so easy to breathe through your mouth, right?
Right.
But the nose can tend to, and I say this in air quotes, forget how to breathe through the nose. It takes a lot of effort for these kids to have to relearn this. And the nose is one organ, you don't use it enough, because we still get air through our mouth. So mouth breathing is never okay, just like snoring is. We want to make sure that is being addressed. Now, if it's, I'm stuffy today, 3 days later, 4 days later, everything clears up and they go back to breathing through their nose, perfect. But we do not want chronic mouth breathing at all.
Right. What if there's polyps or deviated septum, like a physical obstruction in the nose that can make it more challenging for nasal breathing?
That is when I send them to my ENTs. It's like, let's
Yeah.
get this resolved. This needs to be addressed because we're just setting you up to get into the cycle, which is never going to heal. Because, if you have a deviated nasal septum, it's not going to heal itself.
No.
We want to make sure there is the correct intervention is done to be able to help this child then.
Mm-hmm.
I find ADHD is a big one. The signs and symptoms of a child that is sleep deprived are the exact same as a child with ADHD.
Wow. They're overwired. Oh, that's so interesting.
Yes, yes. And, there's enough studies out there that shows when they took a group of kids that were diagnosed with ADHD and they addressed sleep issues. Sleep was evaluated and addressed. They were able to get as much as 50% of those kids off of medication. In my mind, that is huge. That is
Huge.
huge. Yes.
Yes. The less kids on
So,
drugs, the better.
oh my gosh, yes. And I tell parents this all the time when I see them at the practice. If you are facing a diagnosis or possible medication prescription for ADHD, go get their sleep evaluated. If they need the medication, they need it. There's no ifs, ands, or buts. If their body needs it, it needs it. But if we can address their sleep and actually help them, it is well worth the trouble. Because the medications that are prescribed usually have a short half-life, which means these kids end up needing multiple doses. And over time, multiple drugs. And if I can cut that back, because we're talking of children, let's help them feel better if all that child needs is to sleep better. And I'll have parents that go, but my child sleeps for 11 hours and he's still tired or he still acts up. Remember, we need not just enough hours of sleep, but we need enough quality sleep. And that is what these kids aren't getting. They aren't getting the quality of sleep. This quality sleep, enough time in deep sleep, enough time in REM sleep, this is what is going to help rewire the brain. This is when the growth hormone is released. This is when those neurotransmitters are topped off. This is when any toxic buildups, toxins that build up intercellularly are cleaned away. This is when our body does what it needs to do to heal. But if they never get into deep sleep, REM sleep, and stay there for any amount of time, the good work that needs to happen never happens. So they could sleep for 12 hours, but means nothing.
Right. They need the quality.
Right. And then another one I see is kids that are messy sleepers. I used to have one of those. I have two girls. The one would get into bed and wake up, and the only thing you saw was the blankets on that side were a little messed up. And then my other daughter I was like, good Lord, child, did you get into a fight with the bed covers? Because they're all over the place. I'm sure we all have this child in our life. It could be a friend or a neighbor or a cousin or our own kids that they start on one side of the bed and they wake up in a different position. Bed covers are tangled up. They're sweating. They're moving around, talking in their sleep, sleepwalking, nightmares, night terrors. All of this in kids is indicative of sleep disordered breathing.
Really?
Yes.
Wow.
Yeah. And another huge one I find is bedwetting.
Oh, sure. That makes sense.
Yeah. And I tell parents this is not your 2-year-old that is regressing potty training. We're talking of 7, 8, 9-year-olds. I have a 16-year-old in the practice that still wets their bed. Now, that it's not because these 10, 9, 11, 15, 16-year-olds are lazy. There's more going on. There's more to this, right? We know these kids and the parents have tried everything from cutting out liquids after a certain time to setting reminders to use the bathroom. to talking to their pediatricians, to seeing specialists. They've done everything. And sometimes it's just because that anti-diuretic hormone does not get topped off.
Because of the poor quality sleep.
Yes, yes. And if they're having those frequent arousals in their sleep, where they're waking up every so often, their brain wakes them up because they're stopping breathing. Well, they're not quite awake. They're not sitting up, sitting, talking, but their brain has shifted out of that stage of sleep where your body's still doing what it needs to do. And that's when they don't quite have the control over their bladder that is needed. And we have to remember what this does for this child, right? Even a 9-year-old, what social impact is it having on this kid? No sleepovers, no camp, everything. Like that child that I see does not socialize. They choose to stay by themselves with a certain group of people that they feel safe with, which breaks my heart because you want to be out there. You want to be making friends. At this age, it impacts so much more.
Oh, yeah. There's a lot of shame.
Oh, yes. Yes. So those are the main things that we want to look for. I also am very vigilant about habits in kids, thumb sucking, pacifier use past a certain age.
Which age? Past 6 months?
6 months, yes. And even the bottle, I tell parents, the sooner we can get the kids off of the bottle, because when they have the bottle nipple or the pacifier in their mouth all the time, and they're sucking on it, right? That is something that is going to cause narrowing of the palate. We want to give, because it's very few kids that I notice that will only use it to fall asleep and then spit it out. Usually that child is walking around with it clipped to their shirt, or it's their little comfort thing, right? And just that constant sucking on that pacifier or their thumb or any such thing is going to, for one, we've now put something between the tongue and the roof of the mouth and the palate, right? So the tongue cannot do what it needs to do. And the force of the suction of them sucking on it is going to, that's narrowing that palate too. So we're trading one problem for another. So I tell parents this: 6 months, we want to try and wean them off of it. If they're on both, start with one and quickly move on to the other. The sooner we do it, the easier it is for them to get over it.
The bottle nipple is weaned at 6 months as well?
I tell parents that we want to start to wean them off of that. Start introducing a cup. Start introducing the little, what is it called? The 360 cup?
Yeah, the 360 cup. Yeah.
Right. And it's much easier. I'm a huge fan of baby-led weaning. The sooner we can get kids to give up these, like the pacifier and such, the better it is for their growth and development.
Yeah, that makes a lot of sense.
Yes. Now, do you work with adults as well?
Yes, I do. And I see a lot of narrow palates. And I know that the cranium is so much easier to make shifts and changes with as a child, even,
right?
Not just babies. I mean, I do let people know the cranial sutures don't fuse until we're like 80 years old. So even adult skulls, there's movement every time we breathe in and out, but there's just obviously less mobility than a child who's still growing and developing.
Absolutely. Absolutely. Yes. And that's something I'm very passionate about, just fixing these issues in children, helping them get to breathing the way they need to so their bodies can grow the way they need to so they can be healthier adults instead of trying to address it later. And because we see so much more, it's not unusual to see cardiac issues in kids. Obesity is becoming a huge problem as well. And I tell parents this, it's so much easier to sit here and blame video games and computers and TVs. And don't get me wrong, those do play a role. But when I have a child that is chronically tired, that is chronically sleep deprived, I don't know about you, but when I am exhausted, you know what I reach for? Is the junk food. It's hard to convince me to go eat an apple or an orange or celery or carrots because I know reaching for that donut, reaching for the soda, reaching for candy is going to give me that instant high. It's going
Right.
to give me that instant jolt of energy to do what I need to do.
Or a cup of coffee as an adult.
Yes. Yes. And I see that with children too. When they're exhausted, in their brains are doing a lot. They're constantly learning. They're consolidating memories. They're learning new skills. They're going to school, learning new topics, trying to apply them. And then we expect them to play nice with their siblings, be respectful to us, right? And they're tired. They're tired. So making sure that they're getting the sleep that they need, because that's when that leptin and ghrelin levels are where they need to be. The body figures out, gets where it needs it to be, so they're not constantly craving those sugary foods, not reaching for the unhealthy stuff. So it, we could go on and on about how it impacts cardiac health and diabetes and all of that, but just getting that right amount and right quality of sleep does wonders.
Yeah. And I'm thinking, if the child has sleep apnea and it's not addressed, they're going to just grow into an adult with sleep apnea. And there's a lot of studies showing that these adults have shorter lifespans, right? A lot like heart attacks and other things are linked to sleep apnea.
Yes, most definitely. It leads into a whole slew of health issues, which often leads us wondering, but this person was only, insert number. And how did they have a heart attack? Or why is their health impacted so much?
Right.
And a lot of times it takes leading back to, how were they truly sleeping? How are they sleeping right now?
Right. And I think that's a good point. We can look at lifestyle, and that person might be, exercising and mostly eating healthy and yet still die young from a heart attack. Right. And it doesn't make sense. Right. And then you're like, well, there's something else going on here, and we can't blame genetics. there's more going on than that. So
Yes.
I think sleep is really something that's been, overlooked for a long time, and especially in children, the quality of sleep.
Yes.
Wow.
I'm so
So you
glad
have,
there's so many of us talking about this, bringing it to the forefront. So thank you for that.
oh, it's so important. And I want to, let our listeners know about your new book that's coming out, Airway is Life. Tell us more about that.
Yes, I am super, super excited about it. It will be available for pre-order on Amazon February 16th. But this is a resource for us, as for everybody. It's not meant just for doctors or for healthcare providers. It is for everybody: moms, dads, educators. If you have a spouse that snores, if you're worried about your child's sleep, it is a resource for everyday people. Just knowing what can happen, what to look for, who can you ask for help, and what are the options available for getting this person to sleep better, be it an adult, be it a child. What can we do? It's just, like I say, it's like we want to clear the air about sleep apnea in our patients, in our communities, because I find that there are too many questions, not enough answers, not enough resources, and it's too important. It's too important to not be addressed.
It really is. And so I actually, I know you're based down in Texas,
I am in
Dallas.
Houston, yes.
You're in
Houston.
Houston, Texas. But if somebody's looking for a practitioner who does this type of work, what's the best way for them to find them in their area?
That is a good question because I am not aware of any such website or resource that lists everybody under. There's a thought, there's a project for me, huh?
Yeah, just a
But
list of dental
yes,
practitioners that are specifically addressing airway and sleep apnea, because I feel like sleep apnea essentially is assigned to a sleep specialist who's an MD. And
mhm,
then once it's diagnosed, they're prescribed a CPAP machine. But what you're
mhm.
talking about is quite different.
Yes, and sometimes there are kids that need a CPAP. If they need it, yes, it can be an option. The problem that I find with kids and using the CPAP is those straps need to be on so tight. It actually hampers the forward growth of the jaw. So we're trading one problem for another. Besides, the compliance becomes an issue, right? All those hoses and everything. So I find that that is usually something that parents struggle with too. Well, not just parents, even in adults. It's not uncommon for me to see patients within the practice, um, adults that have been diagnosed with sleep apnea, have been prescribed a CPAP. They understand the importance, why they need it, how it's impacting their health, and what it can do if they don't use it, but they're just not able to use it for whatever reason. And there are other options for these patients, for our adults too. Oral appliances can be done. Their dentist can help. So for now, how about if your listeners have questions about providers in their area, we have a contact us form on the website. Feel free to send us a message and I'll do my best to give them a few resources in where they are at until we get that page up on our website.
The website, MeghnaDassani.com.
Yes, that is correct.
Okay, great. Yeah, I feel like that's important because I just recently finally connected with a dentist in my area that I can refer people to. But I feel like you guys are rare. You're rare birds, and we need to know about who you are, and so people can find you. Wonderful. Well, do you have any last thoughts that you'd like to share with the audience?
The only thing I would love to stress upon is ask questions. There is no, and you know this, as healthcare providers, there is no such thing as a silly question for us. So if you are concerned, wondering, worrying about anything, ask. Bring it up with your healthcare providers. It could be your pediatrician, your chiropractor, your body worker, your dentist, your ENT, your cardiologist. We will make sure we try to find resources and options to help you. Unless you ask, there is never going to be an answer. So trust your gut, trust your instinct, keep
Yeah,
looking for answers.
that
Don't,
mama Yeah, that mom
yes,
intuition is so powerful. And
yes,
also don't let a doctor persuade you that it's not to not listen to it, because I've seen that
no,
happen as well. Just
yes,
find another
correct.
doctor, another practitioner who will listen and respect you.
Persist, yes.
Yes. Wonderful. Well said. That is a great way to end. Well, Dr. Dassani, thank you so much for taking the time to come on and share your wonderful wisdom.
Thank you so much for having me. It's been a pleasure chatting with you today.
So, what did you think about this episode? I loved having this conversation with Dr. Dassani about a topic that I believe is really poorly misunderstood and really not spoken about much. But Airway is Life, as her new book coming out is entitled. And it's really important that as parents, we are aware of these symptoms and signs for our children, as well as for ourselves, to confirm that we also have optimal airway when we're sleeping or awake for our brain to properly function. So definitely let me know what you think of the episode. And check out my social media at Brayton Birth Method on Instagram and Facebook for more information of what's coming up next.